America's healthcare advocate, Carrie Hall.
Hello, America. Welcome to America's Healthcare Advocate Show, broadcasting coast to coast across the USA here on the HI Radio Network. If you want to find out more about us, go to the website, americashealthcareadvocate.com. These shows are all posted on our 15 podcast platform and our YouTube platform. Our YouTube platform's got over 450,000 views as we speak. So we know a lot of you are following us on YouTube. So we do the show here in the studio, live on the radio, and then we turn around and post that show on the podcast platform and on the YouTube platform. And I want to say hello to all the folks up in Wheeling, West Virginia, Steubenville, Ohio, WVLY AM 1370 and FM 97.7. We've got a couple of emails from folks up there and just want to say hello and thank you for putting us on the air and becoming part of the America's Healthcare Advocate family. You know, today is going to be an interesting show. The topic is national health care, and I think it's an important topic. And instead of me pontificating on my views about national health care, I'm extremely fortunate to have in studio with me today Dr. Firouz Daneshgari. Hello, doctor.
Good morning.
Great
Gary.
to be here. Great to have you here.
It's a pleasure to be here.
And thank you for flying in here from Cleveland.
My pleasure.
So we're glad to have him. So let me give you a little background on Dr. Daneshgari, and I think you'll understand why I'm excited to have him here. And he's going to be able to talk about his experiences in national healthcare programs like the UK, like Japan, like Germany. So we're going to hear what actually happens inside those programs and how they take care of their patients. So Dr. Daneshgari is an executive surgeon scientist with an impressive track record in training, clinical experience, and leadership in healthcare. He completed his medical and surgical training at prestigious institutions, including Loyola Marymount University in Chicago, University of Chicago, University of Colorado Health Sciences, University of Texas Southern Medical Center, and Case Western Reserve University. He is an assistant professor of surgery at the University of Colorado, a founding member and fellowship program in female pelvic medicine, reconstructive surgery at the Cleveland Clinic, professor and chairman of Upstate Medical University, SUNY, and professor and chairman at Case Western Reserve University, and a founding director of the Urological Institute at the University Hospitals of Cleveland. I think you can see he's slightly qualified. And on top of all of that, he's a retired lieutenant colonel from the United States Air Force Reserve. Welcome. And he's showing me his ID card. And it's great to welcome a fellow blue suiter. So yes. We're well to have you on. So we had dinner, you and I, just the two of us, and we got onto this topic, and I was blown away by your knowledge. More importantly, by your experience, what you've actually seen, and how these systems work. So here's the thing, okay? This Medicare for All, and if you don't think that's an issue, it is an issue, and it'll become a bigger issue depending on who's elected in this particular election that's coming up. And here's the thing, people. You know, everybody thinks that that's going to solve the problem with healthcare in this country. Well, we're going to explain to you what really happens when you have a single-payer national healthcare system. So without that, Doctor?
Oh, thank you, Carrie. As you said, my career trajectory was really being a surgeon scientist. I went through the ranks, as you mentioned, and I was fascinated and filled with enthusiasm how basically I can advance the knowledge and the science through my own work, the networks I had set up, the hundreds of people I have trained, and so forth, until I reached out to the observation that the sickest of all is our healthcare system itself. That is making our people sicker and, frankly, making our economy to suffer. So this happened when I was the chair at one of the major institutions, and because of the success I had, they asked me to serve on the board of that $3 billion enterprise. That is where my attention turned to this fact that our system is sick and needs to be saved. Not only to be saved just because it's not working for our people, is because we are sitting at probably the biggest opportunity, or one of the biggest opportunities in our history, to create the next biggest chapter of generation of value and wealth for our beautiful country. Because the healthcare is the largest industry in this country. Last year, we spent $4.5 trillion on healthcare. And I'm going to repeat that, $4.5 trillion. And that is our entire budget spending. It was about $820 billion. So we are spending 5 times more than our defense budget. And the defense, no one dares to touch us.
So far.
Remember?
So far.
We are spending
Doctor.
5 times more than that on our healthcare, and our people are not getting the value. Number of Americans with chronic conditions is more than half of the Americans. We are spending more than 70-80% of our spending on those chronic conditions such as obesity, diabetes, cardiovascular,
heart
so
attacks,
forth,
stroke.
heart attacks, and the recent data shows our longevity, our lifespan is getting shorter and shorter. One more fact, and I'll stop on the spending. Last year we spent $13,500 per capita, per person per year. This compares to Japan that has spent $4,300 per capita. France has spent $5,900 per capita, and UK has spent $5,400. So we are literally spending more than 2, sometimes 3 times than those peer countries, and our results are worse than them. So we have an expensive and mispriced system. So going back to the issue of the healthcare, the question really, for the bigger question is, what system of healthcare delivery is the best for us?
So
for
let's
our
talk
US?
about that.
Yeah.
So we're spending more. They've got national health care in the UK. They've got national health care in Germany. They've got national health care in Japan. So let's just start with the UK as an example. Sure. And what do you see there in terms of delivering care to patients compared to first of all, choice?
Right.
Okay, and care. Let's talk about getting a hip replacement. Let's talk about stage 2 cancer. What happens when you get to stage 3, stage 4, end of life treatment, doctor?
Sure. For the future of conversation, you can build this whole monster of healthcare into 3 buckets. One is the payer, one is the provider, doctors, hospitals, physical therapy, everything. The second is the payer. The third is the consumer. So about 100 years ago, the European countries, following the Bismarck, who was the Chancellor of Germany, they elected to go what is called the single-payer system. In countries like UK, they chose not only to be the single payer, but also single provider, because during the war, Churchill took over all the hospitals, and they never let go of it. So there's a national health system, NHS in the UK, that is there, and I had the pleasure of working there as a senior registrar.
Was it a pleasure?
Well, the reason I went there actually goes back to the heart of your question. At that time, as you know, I am double board certified. One is in urology. So I wanted to master the art of transurethral resection of the prostate. It's a very technically challenging, and at that time the numbers in the US were low. So I went to UK in Leicester General, and the first day I walked in, the consultant handed me a thickest binder you can imagine. And he said, these are the people who are waiting for this procedure. Choose as many as you want to do, because my aim was to do as many as I could to master my psychomotor abilities to do the procedure. So I went through the list. I picked up as many as I wanted, or I could do per week. So that woke me up that there is a thickest binder waiting list for basically procedures that here in the U.S. you could have done it, next week or tomorrow and so forth.
So when you say thickest binder, we're talking about 3 inches for.
Yep. So this goes back to the issue of the single payer system. All the single payer systems, they have a budget, and therefore they have to ration the care. There is no question in anywhere else. If you go to Canadian system, to any other single payer, they have to ration the care. The number 2 issue is between these 3 payer and providers is the choice of the customer, right? The choice of the customer, where and how basically they can get their choice, is extremely limited on the single payer system.
That's just the beginning.
That's just the beginning.
When we come back from the break, we're going to continue with this into this segment. And then the next segment, we're going to talk about how do you solve the problem. Why is the free market system a better system? Stay tuned. You're listening to America's Healthcare Advocate, broadcasting here on the HIA Radio Network, coast to coast across the USA. Doctors in the house. Stay right there.
The Golden Rule. Treat others as you want to be treated. I'm Steve Keeker, and this is one of the founding principles of my firm, Senior Care Consulting. Since 2002, our value statement has included honor our mother and father, respect our elders, care for those in need, and treat your family as our own. We've been honored to help hundreds of families make one of the most difficult decisions they could ever make, serving them in their greatest time of need. If you're looking for someone who can provide you experienced and objective guidance when searching for a senior care community, reach out today and discover the services of Senior Care Consulting at 913-945-2800, 913-945-2800. Know your options and choose with care at seniorcareconsulting.com.
Welcome back to America's Healthcare Advocate, broadcasting coast to coast across the USA. I'm your host, Kerry Hall. In studio with me, Dr. Firouz Daneshgari. We are very happy to have him here, a very accomplished doctor, scientist, surgeon, someone who's really experienced what it's like on the inside of national healthcare systems. We're currently talking about a little example at the UK, so we're going to go right back to that. Doctor, so now you're working at this hospital. And so you're working all day doing these procedures. They give you a 3-ring bindery, 3 or 4 inches high, filled with people. You just picked who you wanted. There was no system to this. All these people have been waiting for. What was the average wait time before you got there?
Oh, depending on the procedure, the average wait time is anywhere from 6 months to 4 years. So let me.
6 months to 4 years.
Oh, 100%. I'll give you another example of another single-payer system. That is our north neighbors, Canadians.
Okay.
A very good friend of mine, and he gets up in the morning and he has problems seeing. He goes to a doctor and say, "Oh, you had cataract. You need surgery." His vision has dropped to 50/20, and says, "Okay, what can I do?" He says, "Well, this is toward the end of our year. Our budget is finished. We're going to put you on the list for next year." And this is a guy who's running a big company. So he has a private insurance. So that is the fallback remedy for these countries, both in UK and Canada. People who can afford it, they have private insurance. So there's a higher level of access there. So he goes to his private insurance, and private insurance says, yes, we can do this in about 6 to 8 weeks, and the price is going to be over $5,000 per eye with a non-selective lens that we will put into your eyes. So he picks up the phone, calls me. As you know, I have founded a company called Bowtie Medical, where we provide access to fair price procedures
Right.
and So this was on Wednesday when his wife called me. I was in a trip in Colorado. So I arranged for them. They came to Ohio on Monday. He examined his eyes. He had surgery on both eyes on Thursday. Friday morning, he drove back to Canada, to Toronto, for the cost of $1,700 per eyes with the selective lenses, meaning the lenses that he chose.
Right.
So he went back. A few months later, he running a major company, a major construction company. He sold the company, and he wrote me a very fat check, became an investor in our company.
Well, that worked out to be really good. But the point of that story is, and I'm going to ask him, the same thing exists in the UK. You can use the government program, the national healthcare system, or you can buy private insurance. So talk about your experience and the doctor that you worked with who worked on the national healthcare system, but he also worked on the
So actually, all the doctors and all this, by the way, in UK, as you know, the surgeons, they don't call them doctors, they call them mesters. Because they belong to the Society of Surgeons and Barbers.
Okay.
So the Mester, who was my consultant there, they're all allowed to go between 1 to half a day to a day to work in a private hospital, private insurance, where people who have private insurance, they get access to these doctors. That otherwise they have to wait for 6 months or a year or 2 years to do this. As you may know, recently, about a year or so ago, there was a major disaster at the UK setup where a child who had a sore throat, was bumped basically from one hospital to another hospital,
I read
and finally
the story,
ended up
Doctor.
dying.
Yeah.
And that became a major political issue for former UK government. So make the long story short, through all these personal stories, one fact remains solid, and that is a single-payer system has no choice but to ration the care, limit the choice. Number two, the single-payer systems are not more efficient as free market-based systems. The examples of this are throughout the world, throughout the entire Western Hemisphere. As you mentioned, I've had the privilege of being visiting professors in all 5 continents. I've been to China, I've been to Taiwan, I've been to Brazil. The very last trip that made me to really quit my former job and come and build the bow tie was when meeting I had with the Minister of Health in the state of Sao Paulo. And he basically said, they have a constitutional mandate to provide free healthcare to all the Brazilian citizens, but he said we can't afford it. I said, what's the solution? He pulled out his iPhone. He said, go and innovate. Go and figure out what's wrong with your system and fix it. You guys have the best brains in the world. You have the most money. You have the most advanced healthcare system. Go and fix your system, and you will lead the rest of us.
And that was a doctor in Brazil talking about what should be done in this country. You know, here's the thing, all right? And just so we're clear about this, you know, whether it's Kamala Harris or Pramila Jayapal, or whether it's Elizabeth Warren or Bernie Sanders, this is on the agenda. I don't care what you're hearing. I'm telling you, this has never gone away. It's going to continue to be on the agenda. I think it's important to understand what you're getting if you get Medicare for all. And oh, by the way, you are going to pay for it. It's not going to be free. You're going to be taxed, and you're going to pay for it. They're going to tax your employer. They're going to tax you, just like they do with Obamacare. We all pay for Obamacare, whether you use it or not, in case you don't know that, okay? The same thing is going to happen here. It's not going to go away, and this issue is going to be there because the progressives and the Democrats that believe in this believe they want to put this in place. Never mind that we can't pay for it. Social Security will be broke. According to the Social Security trustees, it runs out in 2033. Medicare in 2036. So, Doctor, I have to ask the question. So let's say that the progressive Democrats are able to put this in play, and we go to a national healthcare system. How the hell are we going to pay for it?
Oh, we won't. We'll take our federal government to bankruptcy without a question. I'll give you the numbers again. By the way, I'm apolitical.
I know, he is. He told me over dinner last night. He's apolitical.
I'm looking at the healthcare simply from a professional standpoint. To me, the solution, as you know, they say the healthcare is a right, not a privilege, and I agree with that. The question is not that issue. The question is, what is the most efficient way for us that we can provide the best quality health care at the most affordable level for all of our citizens?
And
so that is the question. It's not whether it's a right or it's a privilege. What is the most efficient way for us we can provide access to this beautiful thing here in this country? Because we have built the most advanced one that all the kings and queens from all over the world, they want to come and get their care, but our own citizens can't afford it. So from a purely technical professional fee, we have a solution in hand that would provide an affordable, highest quality care for all of our people, and that is not a single-payer system. Single-payer system will take us to bankruptcy and will put us in a much more deficient system that we are now.
And they'll make the choices for you. This is the part you need to understand. You're not going to make the choices in a single-payer system. You heard doctors say how long it took to get a procedure, how the example of his friend in Canada, that's what you deal with. And even though they buy private insurance, in the case of the Canadian gentleman, he still came here and got it done for $1,700 an eye instead of $5,000 an eye. That's the glaring difference between a single-payer system and a free market system. When we come back from the break, now we're going to talk about what's the solution here for us to make this work in our country. Stay tuned. We'll be right back after the break. You're listening to America's Healthcare Advocate, broadcasting on the HIA Radio Network, coast to coast across the USA. We'll be right back. Welcome back. You're listening to America's Healthcare Advocate Show, broadcasting coast to coast across the USA here on the HIA Radio Network. You can find out more about us by going to the website, americashealthcareadvocate.com. If you want to make a comment about this show, feel free to do so. Send me an email. The email opportunity is up on the website. You can certainly do that. By the way, the show is posted on our YouTube platform and all 15 podcast platforms, so it's up there for anybody you want to tell about it. I think we make a pretty compelling argument here today with Doctor in studio with us today. So again, in studio with me, Dr. Firouz Daneshgari. He is an expert in this field. He's talking about what his experiences have been around the world. He has worked in these places. He's worked in Brazil. He's worked in the UK. He's worked in Japan, Thailand, Taiwan. He knows how they work and how they don't work. And that's why I wanted him here today. He's a very busy man, but I asked him to please take time and come and do this because I wanted you to hear this from somebody that's been in the system and understands how it works. So let's go to now, you over dinner and then the show notes, which I was working on at 5 o'clock this morning, which was a little difficult after the Chiefs game last night. But having said that, I see, you make the statement here that we could save $2 trillion by going to a completely free market system. Explain what you're talking about. And by the way, in case you're wondering, he's been invited to the EU to make this case in Brussels. Okay, there are people around the world that are listening to what this man is saying, which is why you're going to have the privilege of listening to it now. Doctor?
Kerry, kind of lay out the foundational facts. The facts are we have built the most expensive healthcare system in the world. Again, we spend $4.5 trillion per year. That is 5 times more than we spend on our defense budget. We spend $13,500 per capita. This compares somewhere between 4,000 to 6,000 between Japanese and European systems. So the very first question in my mind, this is about 10, 12 years ago, why we are the most expensive system? And are we providing a better service? Our people are healthier, they live longer? The answer is no. Actually, to the contrary, our services are worse. There is more consumer complaints about the system here, and our health outcome is going through the drain. More than 50% of Americans have 2 or 3 chronic conditions. We spend over 70-80% of our spending on dealing with the issue of obesity, diabetes, cardiovascular. So the foundational fact goes back to that despite this spending 2 or 3 times, we have created a sick care system. So the system that benefits from our people being sick. And the reason for that is that their healthcare is delivered through 5,000 financial institutions called hospitals that benefit from basically sick care. They are financial institutions. They have to deliver a margin. And they have adopted what is known as the more is better. So they focus on the volume rather than the value. Volume means every hospital, the more surgeries they do, the more tests they do, the more procedures they do, regardless of what outcome it has or whether that is needed or not, they make more money. So it's a one-way system between the seller and the buyer. The seller benefits from basically selling more and more and more, and buyer has limited information or choice in saying what I can or what I don't want and how much I pay for that. So that has resulted to 50%, half of what is done in the American healthcare system is an absolute waste. The other question.
And talking about waste, CMS says that $60 billion is wasted every year by Medicare and Medicaid, and you compare that to private insurance. Private insurance on one side is about 1% to 2%. $60 billion represents 10% of the CMS budget. So we have government health care in Medicare. We have government health care in the VA, which I've got a lot of experience with, unfortunately. And then, of course, we have Obamacare. So we've got 3 different systems, none of which do what you're talking about. Okay.
So that is correct. So let me actually rephrase the issues. The issue is, and as you said very correctly, we have had a government-sponsored healthcare in this country. And But the problem, again, the question is not, from a scientific perspective, as you know, these days they're distributing the Nobel Prizes. The most successful scientists ask the right question, right? The right question is not what is basically who pays for the services. The most important question is what is the most efficient way of delivering the services that people need to their hands, right? Again, we have a comparison between the government and non-government. In my opinion, my technical, professional opinion, a free market delivery system that promotes direct interaction between the buyer, that is consumer, that is you and I, and the seller, and that is the healthcare system. That is the most efficient way of bringing efficiency into the system. Going back to the diseases of the sick care system, we are generating more than half of the waste. Why we are generating the waste? Because the machine is that delivering the system has no incentive being inefficient. That's number one. Number two is the consumer is not in the seat of the control. The third-party payer, the federal government for the Medicare and Medicaid for 1/3 of Americans, and the private insurance for 2/3 of Americans for employer-sponsored insurance, they're paying for this waste out of the pocket of the consumer, direct out of the pocket without the knowledge or consent of the consumer. So the employer-sponsored insurance that pays for 2/3 of Americans, the employers are totaling the bill somewhere about $2 trillion. The Medicare is paying about $1.9 trillion for the Americans who use the Medicare and so forth. And this money is paid from the wages of people who work and from our tax dollars. So I make an example. I say we have a gas guzzler system. And the gas guzzler doesn't care who pays for the gas or who rides in the car, right? We need to fix the engine, very much like we did with the car industry and so forth. Tesla, right. So I can go through the details of how the system has supported itself to basically to stay in this situation. But this system has created the misalignments that continues to add to the cost. So there is no light at the end of the tunnel. The cost is going to continue to go up. The more involvement of the government is making it worse and worse, as the data shows. The cost continues to go up. The Obamacare not only didn't provide an affordable care, made it more unaffordable, so they have to change the name of the act to an Unaffordable Care Act, in my opinion. And it hasn't solved the fundamental design problem that the existing system has.
It threw money at it.
Right.
All it did was throw money at it. We started with the subsidies. The subsidies have grown. The number of people have grown. It's done, in terms of getting people health insurance, didn't have it. It's certainly done some good there. But the point is, it's not being done in an efficient manner or in a manner that incentivizes the hospitals and the doctors to deliver effective health care that controls costs. There's no incentive to do that because you're paid for the more procedures you do, you just said this, the more you get paid. So you're going in for procedure. Well, maybe let's get some x-rays. Let's do an MRI. Let's do a whole blood panel. Yeah, I'm sure a lot of those things are necessary. But how much of all of that is necessary? And when you look at the prices that hospitals charge, if you can find the prices, by the way, and you compare typical hospital system with something like the Oklahoma Surgical Center, where every procedure they do is posted online. Hip replacement, 17,000. I don't know what it is, but I'm just going to use 17,000 versus a hip replacement through a hospital system, 50,000. Those are the differences in the system.
So, Kerry, what you're pointing out to the misalignment in the system. The first misalignment that over the past 20, 30 years, this hospital-based sick care system has created. 3 out of 4 doctors now in the U.S., they work for either a hospital or a private equity firm. So the job has changed from being a care provider, problem solver for the patient, for their patients, to protectors of the revenues for these financial institutions. That's the first misalignment. The solution to that is very simple, a direct pay. Direct pay for the primary care, direct pay for the specialty care, called the direct primary care. The second misalignment is that the third party is paying for this waste out of our pocket. The solution for that is rather simple. the direct pay through the HSA, HRAs, and some other solution, the consumer chooses which doctor and which hospital I want to pay, and I want to pay based on the quality and the level of the services.
And so what happens when you come full circle is you hand the choice back to the consumer. You don't take the choice away from the consumer. You hand it back to the consumer, because when it's your dollars, when those are your HSA dollars or your HRA dollars, you are going to look to see if the Green Imaging Clinic can do that MRI for a third of what the hospital's going to charge. The answer is they will. That's just an example of how this all works. When we come back from the break, we'll continue this fascinating conversation with doctors. Stay tuned. You're listening to America's Healthcare Advocate, broadcasting here on the HIA Radio Network, coast to coast across the USA. Doctor's still in the house. Don't go anywhere. Welcome back. You're listening to America's Healthcare Advocate Show, broadcasting coast to coast across the USA. My producer today, Mr. Sean Floyd. Behind the microphones, Mr. Dave Thiessen. Behind all the cameras, the man who puts all this stuff together, posted up on the podcast platform and YouTube, the website, americashealthcareadvocate.com. 15 podcast platforms and YouTube if you want to tell somebody about the show. In studio with me, Dr. Firouz Daneshgari. We're very happy to have him here today. As you can tell, he is a bona fide expert. So we're going to continue the conversation. So we've really defined the problem. So there are 3 points to what you consider the solution. Let's go through those 3 points, Doctor.
Sure, but I want to repeat the problem because I think that has been less spoken of in the national media and so forth. The problem is not who is paying for it, whether the government or a person or the employer. The problem is how can we make the existing system efficient? We have 2 centuries worth of data that shows a free market is the best mechanism to create efficiency, right? I don't have to prove this to you or to the American people, right? The challenge here is how could we put the essence of a free market into the healthcare? Take it out of its current misery. The essence of a free market is, number one, there's an information symmetry, means the buyer and the seller, they have transparent information to the same information. As you know, the stock market, they say, is a very efficient market because there are rules and laws against, hiding the information inside trading and so forth. That is number one. Number two, the direct interaction between the buyer and the seller. Buyer is the consumer, you and I. More than 80% of our health needs are we can choose. They're shoppable. There's another 10, 15% that we may not have a choice, but there are solutions how to handle that. So the second thing is the consumer having control over the money, right, and choosing what they want to buy.
Not the government having
Not the
control
government, not
and
the
choosing.
third party, not the bureaucrats, no other person in this world. By the laws of the universe, by God, religiously, whatever you think, at the end of the day, a person is in charge of their health and the decisions for that. That's number two. Number three is that the freedom of choice. That is a fundamental thing about the American culture that would never, ever the single payer system will work for us in this culture because we are a very diverse country, right? And we have created the 5% of the world population has created 50% of the world's wealth. And that is where my immigrant hat comes in. As you know, I'm an immigrant. I was born in Iran, and I pride myself. I said some immigrants are more American than Americans because they have seen the difference. So
I want you to repeat that because he said that at dinner and it stuck with me. And I was going to ask him to do it, but say that again.
It is very true. It is very true. If you look at the immigrants, the reason the living in the U.S. is the dream of almost everyone around the world is because this country provides this essence of the freedom that the immigrants come in and they, the American dream. And therefore, we do fight more for preservation of these foundations that has saved us. And that is, to me, is the free market. Coming back to the free market issue is number one is the basically separation of the doctors from the hospitals. The doctors cannot be the protectors of revenues of the hospital. That means the consumer can pay directly to the doctors. In the primary care, that is called direct primary care. In the specialty care, called direct specialty care. You can make it the direct payment. The second piece is the transparency of the information. So as you mentioned in the previous segment, like the Oklahoma Surgery Center or Smith Medical now and so forth, there are ambulatory surgery center, the prices are published, you go and pay upfront. Right. Number three is this, that would eliminate basically this whole billing process, which is a joke. 30 days later you receive, this is not a bill, and then after that you're saying the thicker. The next one, which in my opinion provides a freedom for the employers, is what the Trump administration started called the associations of healthcare. That would basically provide the freedom of choice for the employers and the freedom of movement for the employees. So let's say I'm an electrician, right? And I work for this company now, I get a job with another company, and they pay me more thing. With the creation of associations, the Association of Electricians, the Chamber of Commerce, and so forth, they can basically self-insure the health benefits for their employees and therefore provide the portability of the health benefits.
If you look at the Pareto Contrarian remodel, if you look at the Berkeley captive model, those models are hugely successful because of what you just said. Okay, it's a direct payer experience. It's self-funded. They control the whole thing. And they get to choose. So, you have that plan. You can go to the Oklahoma Surgical Center. You, the employer, can say to your employees, if you go to Oklahoma Surgical Center, you have no deductible, no co-insurance, nothing. We'll pay for the whole thing. You incentivize people to make good choices. And that's what we're really talking about here. The problem here, this always centers on the health insurance companies. I'm not an apologist for the insurance industry by any stretch of the imagination, but understand where the problem lies. You just heard this defined eloquently, if I may say so myself, by Dr. today in talking about the problem lies with the hospital systems. Have you noticed? There are no primary care providers that are independent almost anymore. The same thing applies to the orthopedic centers, urology. Go through it. They're either owned by the hospitals or they're giant conglomerates, and that's the way that it works. So it's not what it used to be.
Right, correct. So we are in the political season. Hopefully one of the the next president will pick up this proposal. We can provide unlimited access to primary care, which is more than 90% of the need of a person in the population, for less than $100 per month to all Americans. And frankly, if I was the president, I would sign an executive order to make a unlimited access to primary care for less than $100 a month for all Americans. And now with the advancement of the virtual delivery models, the virtual care, telemedicine, and so forth, that can penetrate to all the rural areas, to the medical deserts, and so forth.
Thank you. This has been absolutely amazing. You will be back. I'm going to impose on you to come back and get you to come back and talk about this. I've never had anybody on this show that could deliver this message like this. I've attempted to do this, and I've used some of the examples, but not the way Doctor does. This is completely different. So I really want to thank Doctor for coming. Like I said, he's very busy. You can tell by all the things he does, including being a CEO of Bowtie Medical. But we'll talk about that in another show. And now I want to leave you with this thought from Dr. Albert Einstein. The one who follows the crowd will usually get no further than the crowd. The one who walks alone is likely to find himself in places no one has ever been. Remember, friends, it's a funny thing about life. If you refuse to accept anything but the very best, you most often get it. Thank you for listening to America's Healthcare Advocate, broadcasting coast to coast across the USA. Goodbye, America.